ClickX Dual Core, the top-loading low-back system. The indications are degenerative conditions or tumors without vertebral body deficiencies, fractures, Type A fractures and similar anterior vertebral configurations in B and C groups, Type A2, A3, and Type C. These fractures must be combined with a ventral body reconstruction. The contraindications are deformities, fractures, and tumors with loss of anterior vertebral body support. The implants needed are ClickX pedicle screws with a dual core and double thread, and ClickX 3D heads. For demonstration purposes, they're colored purple and can be removed. However, for use in patients, they're gold-colored and, once applied, cannot be removed. Also required are ClickX curved 6mm rods and ClickX locking caps with an inner 3.5mm hexagonal screw. There are two instruments used to open the pedicle. The first is the USS Pedicle Awl. The second instrument is the USS Pedicle Probe. A two-level fusion will be demonstrated at L4, L5, and L5, S1. The pedicle is opened in the usual manner. The depth of the pedicle is measured. A screw of appropriate length is inserted using the T-handled hexagonal screwdriver and the holding sleeve. As the pedicle screw is inserted, the holding sleeve is released. The screw is not fully inserted, leaving a few millimeters between the screw head and the bone. The reamer for the ClickX is now placed over the screw head and the bone is removed. The reamer is angled 25 degrees in all directions. This ensures good clearance of bone to allow the ClickX 3D head to be applied to the pedicle screw. The other two pedicle screws are inserted in the same manner. A ClickX 3D head is now applied, using the positioning holder. The positioning holder is removed. The remaining 3D heads are mounted on the other two screws. A pre-bent rod is inserted. The 3D heads align themselves for the rod. The rod pusher designed specifically for the ClickX and the self-holding cap driver for the ClickX locking cap are used to insert the locking cap into the 3D head. It's important that the holes in the locking cap be aligned with the tabs of the cap driver. The rod pusher is used to hold the rod in place. The cap driver is turned to insert the locking cap. A similar procedure is performed on the remaining 3D heads. Compression or distraction can now be applied to the ClickX 3D heads. At this stage, the entire system is loose, and the 3D head will move in relation to the pedicle. To create lordosis at this stage, one of the 3D heads is tightened. The 3.5 mm hexagonal T-handled screwdriver is inserted into the inner screw, and the rod pusher is placed over the head onto the rod. The hexagonal screw is tightened with the screwdriver. The rod pusher and the hexagonal screwdriver are now used for the second ClickX. The compression forceps is applied, lordosis is created, and the hexagonal screw is tightened with the screwdriver. These steps are repeated for the final screw. With posterior lateral fusions, this side is now complete. The same procedure is undertaken on the opposite side, compression being applied to each pedicle. In a non-stable situation, a cross-link from the USS system can be used. In rare cases where readjustment of the implant system is necessary, the 3D head can be remobilized. To do this, the rod pusher, the cap driver, and the hexagonal screwdriver are assembled. The screwdriver is inserted into the 3.5 mm inner screw, and the rod pusher is pushed over the 3D head. The locking cap is loosened and removed with the screwdriver. This sequence is repeated at the other levels and the rod removed. The extraction pliers for the ClickX are now used. The pliers are inserted, the handle is tightened, and the gold inner sleeve is lifted. This releases the attachment of the ClickX 3D head to the pedicle screw. If there is an anterior construct, such as a contact fusion cage, further compression is required across the anterior cage. The unique aspect of the ClickX is that the hexagonal 3.5 screw can be loosened, but the angle of the ClickX head is still fixed to the screw. This allows parallel compression to the anterior implant. This is a great advantage, as it prevents the anterior portion of the construct from being opened. The cap driver and the hexagonal 3.5 mm screwdriver are applied to the screw in L4, and the 3.5 mm hexagonal screw is loosened. The rod pusher for the ClickX and the 3.5 mm hexagonal screwdriver are used. A compression forceps is placed on the rod, and compression is applied across the contact fusion cage. The 3.5 mm hexagonal screw is tightened with the T-handled screwdriver. The procedure is undertaken on both sides. This technique promotes excellent compression across the contact fusion cages. These post-operative X-rays show stabilization of L3, L5 using ClickXs and contact fusion cages.